British Columbia's Health Minister Adrian Dix threw a hissy fit in the legislature recently over one of my reports, where I posed questions to Leader of the Opposition's Kevin Falcon about BC's mandate-happy Provincial Health Officer Dr. Bonnie Henry.
The opposition, Honourable Speaker, talks about ideological in this House. Honourable Speaker, he hasn't attacked Dr. Henry here. The only place I've seen him attack Dr. Henry was on Rebel Media, Honourable Speaker. He went on Rebel Media, Honourable Speaker, to attack the professionalism of Dr. Bonnie Henry. Well, British Columbians know Dr. Bonnie Henry is an outstanding scientist and an outstanding House leader, and certainly, Honourable Speaker, has a stronger knowledge of evidence than the Leader of the Opposition.
Drea Humphrey here with Rebel News, and I gotta say, living under Adrian Dix's skin isn't that bad of a place to be. As a journalist who brings the public the other side of the story, it kind of feels like I'm exactly where I belong. After all, under the leadership of the NDP Premier David Eby, Health Minister Adrian Dix and his sidekick Dr. Bonnie Henry are key forces behind BC's healthcare system that's in a real crisis, not like the pretend crisis the province says COVID-19 still is causing for its citizens. That's right. While tax-paying British Columbians struggle to find a doctor, experience dangerously long hospital waits, repeated emergency room closures, and in some cases are fleeing the province to another country to get adequate cancer care, the BC government remains the only jurisdiction in the country and much of the world to be enforcing a blanket COVID-19 mandate against thousands of healthy healthcare workers.
Folks, it's undeniable that our rights and freedoms are under attack. The Freedom Passport is an easy-to-read, pocket-sized booklet containing the Charter of Rights and Freedoms.
There's an app, too. Visit freedompassport.ca and get your Freedom Passport today.
Healthcare workers like Anne, a psych nurse who's been driven into the poorhouse by the NDP government's medical tyranny to the point that she's gone from serving those struggling with mental health to needing some help of her own.
My life has been topsy-turvy. Yeah. You know, it's gone to the point where I can't keep a roof over my head, you know, and just the mental torture, it's affected my mental health, right? I mean, just every aspect of my life. And I know there's a lot of other healthcare workers that are going through the same thing.
It's stories like that that are why BC United leader Kevin Falcon asked the following question in the House last week.
Here today, and yet this Premier and this NDP government continue to sideline thousands of nurses and healthcare professionals, an approach that is not being taken anywhere else in North America. So if they have some evidence that we're unaware of on this side of the House, what is that evidence, and when will the Premier bring forward that evidence and stop this ideological decision to continue to sideline those desperately needed healthcare workers that we need in our system today?
But instead of answering that question by offering the so-called science being relied on to keep such a mandate for pandemic that's apparently exclusive to BC in place, Dix did what the NDP socialist government does oh so very well and took offense to the question.
Honourable Speaker, he calls it ideological, Honourable Speaker. Yes, Honourable Speaker, it's true. It's true, Honourable Speaker. We were one of the few jurisdictions around that implemented such a measure. And it's one of the reasons, one of the many reasons, why British Columbia led in every aspect of the COVID-19 pandemic. The Leader of the Opposition, Honourable Speaker, talks about ideological in this House. Honourable Speaker, he hasn't attacked Dr. Henry here. The only place I've seen him attack Dr. Henry was on Rebel Media, Honourable Speaker. He went on Rebel Media, Honourable Speaker, to attack the professionalism of Dr. Bonnie Henry. Well, British Columbians know Dr. Bonnie Henry is an outstanding scientist and an outstanding House leader, and certainly, Honourable Speaker, has a stronger knowledge of evidence than the Leader of the Opposition.
Ooh, so hot and bothered. He's like Bonnie's very own Clyde. But is it true that Dr. Bonnie Henry is an outstanding scientist and an outstanding leader? One worthy of her well over $300,000 tax dollar paid salary plus expenses. According to leading viral immunologist and vaccinologist Byron Bridle, who's thoroughly examined the unelected health lord's reasonings for clinging on to her draconian jab mandate, the answer to that question is a hard no.
This is the main camera, right? So Dr. Bonnie Henry, I'm an expert in virology and immunology. I read your document here. You clearly are a non-expert. So this is to educate you, okay? And everybody here so they can educate you. Dr. Henry, your public health order has lots of misinformation in it. It is completely lacking in references to any kind of transparent science. There are so much claims that she makes to justify this with no data. And I was shocked. I thought Ontario was bad. We have it is bad in Ontario, but our data at least is far more transparent than what you have here. I get no transparent data. You have to take her at her word. I don't trust her, especially after what I've seen here.
Dr. Bridle's whole talk really is a must-see, so I've linked it in the written article for this report, which you can find in the description box below. Now, he absolutely destroys any argument that it's science that this government is following to keep this discriminatory policy in place. But it's not just Dr. Henry's COVID mandate that makes her deserving of scrutiny for those with concerns about BC's healthcare. It's also her steadfast support for the province's safer drug supply program. That's right. Dr. Bonnie Henry is a public health officer of a province where the leading cause of death for a 10-year-old is drug use, and she believes we should be expanding the NDP's safer drug supply program, which includes giving addicts who often already use their welfare check to buy drugs more drugs for free, even though she knows some of the government's free drugs have been diverted into the hands of children. Now, here's some sick irony for you. Back in 2020, British Columbians were basically told to shut up about lockdowns and do their part so that hospitals wouldn't be overwhelmed by the pandemic. But what you were likely never told, unless you watched my report back in 2021, was that it wasn't COVID patients that were even burdening the hospitals at the time. It was substance abusers. For example, when lockdowns first began between the months of March 2020 and August 2020, Canada saw a 58% increase in hospitalizations linked to substance use, most of which took place in British Columbia. In just those 3 months, BC had 8,566 substance use hospitalizations. Yet in those same 3 months, plus 3 more, the province only had 567 COVID hospitalizations. So why then, in 2024, is Bonnie Henry still preventing healthy medical professionals, including paramedics, from helping with certain mental health and addiction programs and caring for people affected by our overdose crisis? I can't give you the answer to that. But what I can do is ask politicians the right questions when I see them, which is why at a BC United Town Hall, I asked their leader, Kevin Falcon, what, if anything, his party would do with BC's mandate and safer supply enthusiast, Dr. Henry, if his party were to form government after this year's election. Here's the answer he gave that apparently triggered Adrian Dix.
She won't be working for us. Number one. Number two, I think it's important you know that at a time when we've got a healthcare crisis, we have thousands of healthcare workers that are unable to come back to work. We're the only jurisdiction in North America that is still saying you cannot come back to work. And I called back for as far back as 2 years ago. Almost 2 years ago, I said, bring those healthcare workers back. We need them. I know there's the lead nurse at Langley Memorial Hospital, head of the emergency department, cannot come back to work because Adrian Dix and Bonnie Henry have decided they're not allowed back into our healthcare system. That is just ideological. There's no scientific medical foundation or reasoning for being able to keep them out. Somehow everywhere else in North America said, yes, bring back those healthcare workers, even if unvaccinated, so they can help us deal with the healthcare crisis. I do not know, other than their ideology, why they continue to punish people that could be helping us at a time when we need help in our healthcare system.
Now, was that really attacking Dr. Henry? Adrian Dix says so. But is everything Dix says with a straight face even true? I have an interview coming up with Lex Acker, a seasoned charter financial analyst who specializes in finding inconsistencies in financial statements. And he's going to take you through some data that suggests the answer to that question is also a hard no. And it's reports like that that I think was the real reason behind the hissy fit Dix threw in the legislature. Dix knows that wasn't an attack on Henry. I think what he was really trying to do was to publicly call out Falcon to serve as a warning to him and all of the other MLAs that he's watching, and will call them out too if they stray from talking to the state choice media and saying anything less of worship about his precious Dr. Henry. And who knows? Maybe that type of intimidation is working. You see, the Conservative Party of British Columbia has always answered all of my inquiries, and BC United was too for a little bit, until recently, where several of my inquiries to them have gone completely unanswered, like I've been ghosted. But, Mr. Dix, this is Rebel News, and I'm Drea Humphrey. You may be able to bully some politicians out of answering questions for the public in effort to control your narrative, but you won't bully me from finding the people the answers one way or another. And it's many of those same people who will be voters come this October. Drea Humphrey for Rebel News. At Rebel News, we don't back down from bringing you the other side of the story, even if we have to work harder to do so than state-backed journalists. That's why I am dedicated to giving you reports you can trust about this year's election in BC. So if you haven't already, go to our special website called leadershipreports.com and give us your email so you get those reports. And if you appreciate our boots on the ground reporting, please consider chipping in a few bucks to help cover our costs to bring you it while you're there.